So, as Barbara said, I'm going to provide an overview of listening to and engaging with our communities from a clinical perspective. And then my colleague Barbara will provide more of a research perspective. So first of all, why is it important? Why is it important for us to listen to and engage within our communities? Well, in maternity, developing community connections is a vital part of healthcare provision and addressing health inequalities. And for a long time now, we've been very lucky in maternity to have the Maternity and Neonatal Voices partnerships, and that's sometimes abbreviated to MMVP. And they're predominantly our source of public and patient engagement. But there's no MMVP out there that is inclusive of all underrepresented groups. And so sometimes when you need to have specific voices to be heard, it's really important that those appropriate groups are able to have a say and you approach them directly. Otherwise, we are at danger of generalising. And so the community connections established, and some of the ones I'm going to share with you today, are there to enhance but not replace our maternity and neonatal voices partnership connections and relationships. So first of all, it helps us to learn and it helps us develop our cultural awareness and responsiveness. So you have the real opportunity when you engage with communities to fully immerse yourself within that community, and you end up being their guest. So unlike when a patient comes to hospital, they end up being in a familiar surrounding that's familiar to you. But this is flipped, it's the other way around, and you're in an unfamiliar surrounding. And so you really get to feel what that's like, how lost you might feel, how polite people are to you, how welcoming people are, etc. And it also provides a voice to those seldom heard. And it provides an opportunity for us to listen and get some feedback on some of our practices. So within the NHS, we tend to use mechanisms like friends and family test, PALS, complaints, etc. And they inform us sometimes of what's going well, what's not going well, and helps us to shape and redesign some of our services. But if we have a look at who it is that accesses friends and family tests, PALS and complaints, they're predominantly English-speaking white British people. And so if we're using these mechanisms to improve our services, we're not really hearing all of the voices of the people that use our services. And so if we're using that to redesign our services, we're only ever going to redesign them and keep our services going for the majority of people who fill out the complaints, FFTs and PALs. So we're further widening that inequality gap. So whilst there's definitely work to be done to make things like the FFTs and PALs, etc., more accessible for a diverse range of voices, there's also ways that we can directly engage with our communities and get that voice from them as well. And it also supports with building credibility and trust. So unfortunately, midwifery services have been in a bad light for some time now in the media, and that has caused general mistrust within the communities. But by going to the communities, you can really share what you're doing to support change. And because you're visible, it really makes a difference on the ground. And you're going to the community rather than people coming to you. And people do start to think differently about how they're providing their services. It supports you being visible and being present and being available. So I'm going to provide some success stories now and provide some tangible examples of some of the community connections that have been built over the past 12 months in Leicester and Leicestershire and how these have made a positive impact. I'm going to share 4 examples. So the first example here is with Trade Sexual Health, and they're a Leicester charity supporting LGBTQ people. And through those community connections, Trade invited us to attend Leicester Pride in the summer last year. And it was absolutely fantastic. That photograph, if you're watching live at the moment there on the left-hand side, shows us at Pride, and we had over 1,000 people visit our tent. And the stall that we had there showcased how UHL Maternity are supporting LGBTQ plus service users. And we also included, with consent from the families photographs of trans people who had used our home birth service and had a home birth with us. And we also had a suggestion box for people to give us further ideas of how we can improve our service. And it really showcased how we were supporting the LGBTQ plus community within our maternity services. And we had lots of people visit our stall. As I said, 1,000 people, but some of them were actually colleagues who worked in, different NHS trusts. There were commissioners, there were GPs that had come to visit us, and they all came to congratulate us on the work that we were doing and reported that we were really leading the way. And a lot of people said, we've never ever seen a healthcare provider, let alone maternity services, at events like this, and it was absolutely fantastic. So we tailored the information that we were providing to support our LGBTQ community. And through the connections, the charity also supported us with the development of a focus group to inform our perinatal guideline for trans and non-binary people. So the guideline shown there, perinatal care for trans and non-binary people, the public involvement in the focus group really helped us inform what we were going to put in the guideline. We then reviewed it with our focus groups and provided them with the edited version, showed how their voice and suggestions were incorporated into our guideline. And the group were really pleased with their involvement, and some of their feedback is shown on the screen there. So they said, I would feel safe in the care of UHL maternity staff knowing this guideline's in place. Well done. You've got this spot on. Very minimal changes needed. This is fantastic. And I hope other hospitals start to include this. And I think you've done a great job. It is great that you have asked for our feedback on this. So really, really pleased with that. The guideline actually is available for anybody who wants to see how, what we've put together, because there aren't many trusts that have got a guideline like this. So there was quite a lot of work that came into that. So I'm happy to share what's in the guideline and some of the things that we've suggested. You can just Google that guideline and it will come up. The UHL guidelines are public facing. So happy for anybody who wants to access that. And then most recently, Trade Sexual Health have supported with the development of e-learning module for our staff. Just low-level information, but supporting our staff to understand terminology, what the colour of the pride flag means, what LGBTQ QIA plus stands for, etc. So they've also fed into that as well. We've continued our collaboration and work with them. Moving on to my next example. So this is an example from a place of worship for the Sikh community. So it's the Sikh temple, the Gurdwara. And the committee members agreed for my presence there at key times within the year. And this is to support some information sharing about pregnancy and childbirth. And first attendance was at Diwali. So one of the biggest festivals that happen within the Sikh and Hindu community, and we shared really important information on public health messages there. For example, mental health, which we know can be a bit of a taboo in the Sikh community. Shared how to access a translator in hospitals, the importance of early booking in pregnancy. We know that there's some disparities in late bookings with certain ethnic groups, and Indian is one of those groups. And I was able to speak to new parents, prospective parents, as well as grandparents and in-laws, which we know have a huge influence on decision-making for pregnant people and their partners. And that was a pilot. Attending on Diwali was a pilot, and it was such a success that we subsequently were invited to attend some baby and toddler sessions, Ask the Midwife sessions. And I was invited back to speak at International Women's Day about pregnancy and childbirth topics. And because I'm from that community myself, I was able to do it in English and Punjabi, so I used bilingual language skills and had that knowledge of cultural sensitivity to ensure that what I was sharing was received in a positive way. And places of worship provide a valuable platform to share in a lot of these key messages, especially when you're invited by community leaders, and keep getting invited back by community leaders who support and advocate for your work. And then finally, most recently, UHR Maternity was also invited to Vaisakhi, which is a Sikh celebration of the spring harvest. It's one of the busiest festivals in Leicester. And again, we were able to showcase some important information, including Punjabi dietary advice for diabetes, the importance of taking vitamin D in pregnancy, and much more. And there were quite a few people who were new to the country that had attended that festival to have that kind of sense of community. So I was able to talk to them. They were either, trying for a baby, or just thought, well, in the future, I might. Where do I start? What do I need to take? What's the good preconception advice? So it went down really, really well. Moving on to my third example, this is with food banks. So as part of my Core 20 plus 5 ambassador project, so just to explain what Core 20 plus 5 stands for, Core 20 relates to the 20% of the most deprived areas of England. And then the plus 5 elements relate to key vulnerable groups, pregnancy and maternity being one of them, and also additional inequalities, like, for example, asylum seekers, sex workers, homeless, etc. And so one of the ambassadors put me in touch with community leader Katie, who runs a food bank in Beaumont Leys, which is part of the Core 20 area of focus. And I just wanted to pay a visit and kind of learn so much more than I had anticipated. And up until then, only really thought that food banks were to support with providing food and supporting with food deprivation, but they're not. So what else they do? So they provide a range of different essential services to support overall well-being. They work really closely with libraries as well. So this food bank, for example, supported with connections and supported directly within the food bank itself with English language skills, digital skills like how to use the NHS app, prescription ordering, how to order your prescriptions, and CV writing and employment support. They also provided culturally specific food options like halal. They also provided gluten-free, and it was just a fantastic community resource. And midwives play a vital role in identifying challenges that families face. They're one of the very few healthcare professionals that still kind of enter people's homes, and so they can really witness the day-to-day realities. And there's a lot of time pressure during kind of appointment times with midwives, so it can be difficult to provide this comprehensive signposting to additional support like this. So I worked with Katie to design a really simple information sheet for our community midwives that provided an overview of the service and how the midwives can get in contact with the food bank, or how they can provide the information to their caseload to then get in contact directly themselves. And, by increasing awareness of these community resources, midwives can really help ensure that families get the support that they need. And a lot of these initiatives, particularly things like libraries, which this food bank worked very closely with, are always under threat of closure because they're underutilised. Yet they are providing so much support, and it's just about knowing as a midwife that we don't always have to do everything ourselves. There are plenty of other services out there in the community that we can use to support the people in our caseload. And then my final example is with Leicester City Sanctuary, and they're a charity in Leicester that support asylum seekers and refugees. And through setting up community connections with them, we've been able to refer a lot of our asylum seekers and refugees within Leicester City to the charity, and they've really supported them with companionship, signposting to other services, and access to hot meals. And just last month, myself and a colleague were invited to attend a family event, and it was set up by the charity, and 15 families joined us to learn more about pregnancy and childbirth and how to access the NHS. And it was lovely because Amy, who's pictured here with me in the selfie there, she's our specialist midwife for asylum seekers and refugees, and was recognised by some of the family members that had continued going after she'd referred them, which was just really heartwarming to see. And, we went to the people, we were visible, and we were there to explain how to access a midwife early on in pregnancy, again, how to access an interpreter, debusting a lot of pregnancy myths. And in addition, we did an activity with the attendees to help us understand how we can best support giving complex information in pregnancy. For example, the induction of labour process, which is hard enough to explain if you if you can read and speak English. So we did a bit of an activity with them. And then just last week, we were back at the charity. After it was brought to my attention from midwives that that our asylum seekers and refugees, it's a generalisation, weren't following particular health information advice. And they kept coming to me and saying, but we keep saying this, we keep saying that, but every time I go, they're not following the advice. And I thought, well, there's got to be something that we're not doing right here then. Let's have a look at this differently. And we need to perhaps approach sharing this public health information in a more culturally sensitive way, rather than just our rote learnt information that we've been saying for years and years and years, and it's not actually personalised. And so I set up a focus group with the charity, with Maggie, who is the family's lead support. And she identified the people to attend the focus group. She provided us with a venue and refreshments. And, it was really inclusive. We supported parents who, people who've already had children, so they were parents, and we had childcare facilities there so they could take part in our focus group. And all of that made this focus group a success. And we had people attending from Sudan, Iran, India, Honduras, Ethiopia. They spoke an array of different languages: Arabic, Spanish, Hindi, Kurdish, Sorani, and much more. And they really helped us understand the cultural difference and some of the barriers that the way that we were currently approaching this healthcare information. And they also, most importantly, provided us with some solutions. So we're just pulling those narratives together and look forward at trying to implementing some of those solutions. And I'm happy to share that wider when it's gone through our internal governance structure, etc. And we will be keeping that group informed of how we've taken their solutions on board, or alternatives if we've not been able to go through with that. And Maggie's going to support us with keeping in touch with that focus group. And we're going to be providing them with a gift voucher each as well for their time. Comes a bit later on with my top tips with community engagement, not to expect people to do things for free for you. So we are providing a gift voucher for them as well. There's some feedback there on the slide. From the focus group, people were really happy for the time that we spent with them, and they were thanking us. Really, we were the ones that were really thankful, and they were just really grateful that they were listened to. And I just want to read out something that Maggie had sent myself and Amy afterwards. She said, I think from these responses, you can see how much they valued being asked their views, being really listened to, learning from you, and also feeling they had something important to offer. I'd personally like to thank you for the very sensitive way you approached the session. I could tell that they all wanted to contribute and share their experience, and it was very moving for me to witness that. And I'm so glad we have developed this partnership. So really, really pleased with how that went. Okay, so just moving on then to my top tips. If you're looking to support with community connections in your area. So as I've said there, reimburse people for their time. That could be in different ways. I've said about vouchers. When I went to the food bank, I didn't go empty-handed. I stopped off at the supermarket. I'd looked online what it was that they were short of, and I filled a couple of boxes and took that over for them. And that's really, really important. You're asking for their help as much as you're providing them with support. It works both ways. Really, really important to keep in touch. When you're developing community connections, you shouldn't just go and get what you want from them and not ever make contact with them again. You've got to keep in touch, and that can be quite challenging, but there are various ways. So some of the ways that I keep in touch with various community connections, and sometimes it's via email, sometimes on social media as well. I've invited them to things I've been going to. They can't always make it, but it shows I'm thinking of them. Sometimes I'll send just a message to, Temple for Happy Diwali, or to one of the women's charities that I work with, Happy International Women's Day, and things like that. It's really, really important. And that really supports that two-way dialogue. Following up with the community is really important. So if you're, for example, doing the focus groups, etc., or the guideline that I'd shared, it's really important that you follow you keep them in the loop and you don't just not see them and get in touch with them after you've got the information, because otherwise they'll just think, well, I'm not going to engage again. It's really important to support, building that trust and show how their contributions were really valid and how they've come to fruition. Amend your approach and make it appropriate and sensitive. So, for example, we amended our approach when we went to Pride, and we put up pictures from our home birth from a trans and non-binary perspective. We go to a Sikh temple, putting up pictures of any type of birth is probably not the most sensitive thing to do. So we reviewed that, but we provided information about the home birth service rather than photographs. It's really important. You do have to adapt the information that you provide and be flexible. A lot of this has been taken part on weekends. Some are very last minute. So they might just get in touch with you and say, oh, there's such and such happening tomorrow, or, this week we thought of you. Could you make it? And it's important that not everybody works in the same way, and you have to be flexible when you're working with the community. So my final um, thoughts here before I hand over to Barbara is that building community connections takes time, and not every effort will yield the same results. I've shared you my success stories. There are plenty of others where it's not quite what I anticipated to be. But don't limit your outreach to just parents or parents to be. Engage with everyone at these sorts of events and community engagements, including other attendees, extended family members like in-laws and community leaders. It's more about than just it's more than just spreading information. It's about building trust, shifting perceptions, and creating meaningful, lasting relationships within the community. Just share there my email address and social media handles, and I'll hand over to Barbara.